Hi there, it's Dr. Jeff Pierce from Michigan Sports and Spine. Apparently we're closing in on our 20th episode, and we're going to do some real exciting stuff for our 20th and our 25th. We haven't figured it out, so any suggestions that you bring to us, we'll definitely consider it. It's been a crazy week. Last week, if you heard, I dropped my daughter off in Colorado. It's my first week without my middle child. Was actually got up north. So I actually want to talk a lot about exercise and stuff like that. My friend who had me stay at his place, we're going to talk about some of the things that he brought up too, if we have time. But a lot of subjects. It's weird. Questions are coming to me from a lot of different avenues these days. I know we're all getting busier, especially with school coming together, and what to do and where we should be going and how we need to handle things. So that's a lot of nothing I've just said, but bottom line is we're trying to answer your questions, and they're coming more fragmented lately. It's not like specific, I have back pain, this is what's going on, and that's why I need treated. It's different kind of questions. It's community questions, it's social questions, which I think we're reaching a broader viewpoint when they're starting to ask these kind of things to me. So
you see Paige's comment?
Huh?
Paige commented on your haircut.
Well, now I know my daughter is watching, so for those following, she likes my haircut. She heavily criticized me last time I looked a little bushy. Anyhow, on to more serious things. We've expanded. Before the COVID, we were looking to merge. A lot of you might have heard we were merging with Dr. Abrahamson downriver. Dr. Bonnet has joined us. We have another new doctor out of Chicago joining us mid-September. So she's going to be here. So there's a lot of new staff members, a lot of new people. We have new front office. So, and the thing is, with some of this COVID, we feel like we're doing a lot better. We're in the midst of change, and not just in the medical field, in a lot of fields. I mean, there's been a lot of changes with COVID. We're no different. We're not immune to it, but we're trying to take it into a positive aspect. We've been able to take a step back. You see a lot of people have been remodeling their facilities, their restaurants. They took this time off, this quarantine time when things were slow, to come out even bigger and stronger. And we want to be one of those also. So we're looking to improve our staff, the way we do things. We're looking at different ways of efficiencies with our electronic medical records, being able to keep track of things a lot better, and changing my ways. A lot of you have met Kate, which is an assistant to me, who is way more familiar with social media and computers. So I think it's in the big picture, we're going to be a lot better off. So our staff is great, a little bit of a turnover, but mostly for expansion. And I think we're coming out we'll be a lot further ahead when all this is done. So that kind of answers question one, which is straight up, tell me a bit about your staff. So starting from the tops, obviously myself, we have Dr. Bonnet, who started last week. He's seeing patients, he's getting busier. He's a little bit quieter in the office because I think he needs to stay busy. We have a new physician assistant, Rosine with myself, Kate with myself, new front staff, and then we've also expanded our medical team outside of the office practice. So a lot of new faces, a lot of new excitement, brings me some young energy, keeps me younger and more motivated. So enough of that. So question 2, it says, hello, stress has caused me to have terrible headaches that are brought on by my tension, stress in my neck and back muscles. I have been to a chiropractor and general practitioners. I have had chiropractic adjustments. Can you help? So this is not a very uncommon situation. And the thing is, with COVID and everything else, I've talked to a lot of different people who say how stressed they are. Even though they're sitting at home, they're getting paid either from government checks or from being paid at home. I just talked to my banking individuals. The banking system still isn't going back to work to January. So you're at home, you're in your own environment. So stress is starting to happen in different forms. I'm thinking you're at home, you're in your own environment, you're able to control it a little bit more. but different stresses are coming out. So when we talk about headaches and things like that, like this patient, absolutely, stress can cause tension headaches. So a tension headache, just to talk about that, versus a potential migraine, migraines form technically behind your eyeballs, as opposed to a stress headache that happens what we call the occipital area, which is the neck and the skull come together. So if your headaches are coming up and around your head like that, ideally that's more of a tension headache, which is caused by stress. And a lot of times you hear about people getting bite protectors for their teeth. If you're sitting there clenching your teeth all night and you're stressed out and you have terrible dreams, or you watch CNN before you go to sleep and you're stressed out over that, that'll cause an altered mood during your sleep, causes stress. So if you're gritting your teeth, if you grind your teeth, all that will create like tension. A lot of times I tell you to just breathe. That's why I've pushed yoga so much, because it kind of relaxes your muscles as a whole. So what you want to do, if it is a true stress headache, we definitely can treat it. Chiropractors typically will be successful if it's more of a mechanical, manual thing. They usually can resolve it. If it's now getting where the headaches are turning into numbness and tingling, and like I get tingling into my ears, up around my eyes or into my face, now you're talking more serious. Like I said last week, when the nerves or the numbness or the tingling, that's nerve related. That's always a little bit more of a red flag for us. That has to be treated more aggressively, as opposed to the more mechanical changes where I just feel tightness and muscles. We can usually resolve that quicker. We want to get both of them early, but if you're already where you're feeling a numbness and a tingling, then we're kind of battling it uphill, and it needs to be addressed quickly. So the chiropractor, if it's not doing well, or you're having an adverse reaction to it, you definitely need to get in here. The general practitioner, he tries, he takes care of the blood pressures and things like that. And some do specialize in mechanical musculoskeletal things. But for us, this is exactly what we specialize in. So if this has been going on, like my rule is 2 weeks, if it's going on for longer than 2 weeks and not resolving or getting worse, you definitely need to be seen by a specialist. Definitely here we can handle it, or someone similar to me. So hopefully that answers your question. There's different types of headaches, just to summarize. There's the stress headaches that come from the back and kind of wrap around, versus the migraine that starts in the front, gets behind your eyes, you get nauseous, things like that. So it's much more involved. So the other thing is, if you can't distinguish between the two, it's important to see someone to distinguish between the two, because they're easily treated. We also, just to add one more thing, we also see a lot of whiplash injuries. Whiplash doesn't just mean a car accident. It means, a buddy was goofing around at the lake and pushed you really hard on your back, and you had that whiplash motion where you hyperextend and you come back. So whiplash doesn't mean you equal a car accident. I see it in all my sports players, especially hockey, from being hit from behind, goofing around, falling out of a chair, anything. So it's that real whipping motion of your neck, which will also cause severe headaches, and we need to address the issues on the neck to resolve it. Okay, so question 3. Why is the thoracic area so painful, and why does it cause the pain that goes around to my stomach? So the thoracic area, for the people who don't know that area, it's the mid-back. It's from that pointy spot in your cervical spine, your neck area, all the way down. So again, if you put both your fingers on top of your hips, that's your L4, that's the lumbar 4. If you go up 4 segments to that, that's the junction between the thoracic and the lumbar region. So if you can see my little friend behind, is it gone? There he is. So you can see his thoracic spine kind of below his rib cage there. So that's the area we're talking about. This person here is talking about wrapping pain around to the stomach. So that's very concerning. So that's kind of below what we call the nipple line. The nipple line is considered the 4th level. This is below that. So you're somewhere between the 6th, 7th, and 8th area if you're getting referred pain to the stomach. Referred pain to any of your organs or your belly is more concerning. That's more of a red flag for us that there's nerve involvement. Classic mid-back pain is more mechanical in nature. What's nice about the thoracic spine is it has the rib cage, which is a natural bracing of the spine. So it's very hard to disrupt the mid-back as opposed to the neck and the low back, which are kind of free-floating. The mid-back, the thoracic spine, has the whole rib cage that balances it and locks it in. So if you're having that kind of discomfort, that's a little concerning, not alarming you, but that needs to be looked at right away, a little bit more than a therapist and a chiropractor. You probably need some further imaging if that's truly what's happening. And the other thing that could be happening is you may be having ulcer or irritation to your gut, which is also creating a referred pain. But stuff like this is what I worry about. Thoracic pain as a whole is usually well treated and easily treated. When it's starting to wrap around, that's like what we call, like I keep calling one of our red flags that needs to be seen pretty quickly. And we just got to make sure, from examination, I can pretty much rule out anything that's real serious. If it is a little bit more concerning, then we would be doing imaging right away. So, I wouldn't, blow this off for too long. All right, so number 4, what would you say is your most memorable part of treating athletes or singers so far? Are you still doing this? So, for those who don't know, the fun term is called Doc Rock. I've been the physician for entertainers in Detroit, Southeast Michigan, everywhere since 2000. 2000, I became the head physician for the arena football team that was at the Palace. From there, I was asked to start treating all the entertainers that came in. So I've been doing it since 2000. So it's been pretty exciting. I really can't talk about any of them, but I've met just about everybody. The only person I really didn't get to meet was Michael Jackson. But anyone else you name, I've pretty much met or treated or had my abilities to work with them and help them out. And sometimes they'll ask, what kind of entertainers do you like more? The country musicians have definitely been easier to work with, but all of them have been fun. Someone just asked me about Lil Wayne, have I ever met him? And yes, I have met Lil Wayne. He probably doesn't remember me, but I'm sure it was a moment for all of us. But some of the big ones, like Prince, I have great stories about Prince. He was just phenomenal from an entertainer, but also as a person. Obviously, people were close with the guys locally, like Kid Rock, which I've had multiple phone calls to resolve some issues. But probably when we go with the entertainers, yeah. But also the funnest years, we're also dealing with the Red Wings during the Stanley Cup days. And again, I can't really describe any full details on it, but those were exciting times. I mean, I got the benefit of being on the ice in Pittsburgh when we won the Stanley Cup and drinking out of the Stanley Cup myself. And those are probably the biggest memorable days that come to mind. But from an athlete standpoint, obviously I was closer to the Red Wings. The arena football, that was exciting. We got into the playoffs the first year. But there are multiple stories that people will say I should write a book, and we can't do it because we have that HIPAA guideline thing. But it's just been exciting. I have a reputation around the country that I'm the sports medicine guy to see, as opposed to other guys that specialize. Some are in the ENT docs. They're a little bit better with voice or ears. I've fortunately got canned on a website that I didn't know about through the entertainment community. That Dr. Pierce knows what he's doing. He's been great, and he has this great charity. So he never asks to be paid. He always asks for donations for his charity. So that was a big positive. That a lot of the entertainers have over the years been very gracious and donated signed guitars. Keith Urban gave me a jersey that he had signed in San Jose. Just some cool stuff we've acquired, even some of the local guys, Eminem and Kid Rock and Seeger and all that. So it's been very beneficial. It's opened doors of excitement that we kind of take for granted, which I really have realized this year because of COVID, everything being down. A lot of my friends at Live Nation, shout out to them. All the people at the Old Palace and now the 313. They're all, I keep in constant communication with them. We miss each other. I mean, I would be at concerts up to 7 days a week where we're communicating or dealing with an issue with the entertainers or needs that they have, last minute. Nothing's like prepped out. It's rare that like, oh, we're going to be here in 3 days. We're going to need this. That happens about 10% of the time. It's usually at 5 o'clock when they're opening doors at 6:30 when there's issues that come up. So All that's missed. I will admit I took it for granted how much fun and activities and stories that we had. So it's a fun part of the summer that's definitely missed. Just faster horses. We've been going to faster horses since the very beginning when it opened. The team that started faster horses they blossomed into huge country festivals throughout the country now. So it's great to know these people and the success they brought and the fun that they brought to so many people. It's just it's a sea of people. I don't know if you've ever been there, but it's cool sitting from backstage and you can just see that sea of 60,000 people or more. Or even at the Kenny Chesney concerts where it's full Ford Field filled and you're sitting backstage just seeing that whole view. It's amazing. And what's amazing is that so many people are happy for those couple hours that they're there and enjoying themselves. So that's been greatly missed this year, and we're hoping that 2021, I know they're already planning a lot of concerts and things are going to be different. So all those people that keep asking, can they come backstage with me, is probably a definite no, at least for 2021. But we're looking to make up for it. And things are going to be different going forward. But the entertainers, I think, feel the way I do on a much higher level, that they're all missing it. It's their energy all the way down from the production teams that work on the sets. It's like their release, their therapy. So a lot of people are being missed. So athlete-wise, we're still dealing with the athletes, the singers and the entertainers. They're getting hurt from other reasons. It's not necessarily related to their concerts. But everybody's real active and getting back to it. So hopefully that answered your questions. I know I didn't say anything in true detail, which I can't. But like I said, they've all, probably the biggest one for me was Sir Paul McCartney. I grew up in that time frame where the Beatles, you'd listen to the Beatles before we go out, to the young little parties and stuff like that. And, to meet Paul McCartney was pretty huge, and just all the greats. I've been fortunate to meet them all and work on most of them, so it's been pretty cool. All right, so moving on. I promise not to get emotional this time. My daughter out in Colorado is still giving me the business, but yeah, I'm very proud of her. She's doing great. So we'll just keep updates on her. Maybe we'll have the page update every week that she's doing great. She's ahead of herself in class, so I'm very proud of that. So last question, are you seeing new patients through online appointments? I'm still hesitant to come into the office because of COVID. The answer is definitely yes. We feel like we've mastered telemedicine as best as possible. We've replaced at least being able to figure out the real bad things, at least get a treatment program started so you're not waiting another month or two, because we don't know what's going on from the government. Everybody's saying it's related to the election. I'm not going to voice my opinion on that, but I'm not going to argue with it either. But I think we're at least through November with this, and now even like a big bank like Comerica, they're not going to be putting all their employees back until January. So it's hitting everybody at all levels. The schools are, you have one kid that's not in school, one that's fully in school, and one that's doing a hybrid. So we're seeing it all across the country now. But definitely doing the online, the telemedicine, which I think has been very beneficial. I think we've proven a network that has worked. So the simple answer is yes, we're definitely seeing people online. We're seeing people in the office. We're expanding our hours. Now with Dr. Bonnet started and Dr. Abrahamson, we're also going to start pushing our I don't want to say alternative medicine between Dr. Abrahamson and myself, but we're really going to start pushing more for the PRP and stem cell. Right before I came on, I had one of my patients that I haven't talked to in 7-8 months. We did a PRP injection in her back a year ago, and I thought she didn't like me anymore because we haven't heard from her. Basically, she has been perfectly fine. She says she's never felt better. So she's had unbelievable results. And that was my old style. What we're doing now is we're being more aggressive. So she's actually gotten 12 months of relief, and now it's slowly coming back. So she's being proactive. So we're probably going to inject her again. But we're now seeing if we do the PRP injections every 3 months, we're seeing a more accumulative effect. So, kudos to her. She's done great. She followed through. She was a perfect patient where she listened and she followed through with the home exercises. She continues to do it. but she is a little bit on the, a little bit aged, so there is arthritic changes that we can't change with PRP, but we're also getting much better results where we're getting that healing process. So our new technique right now is to do the steroid injections, bring the pain level down, and then allow the PRP and stem cell to start working is the healing part of it. So we don't want the PRP and stem cell necessarily battling the pain part. We want to bring that down with the steroid injections, and then we're seeing better results with doing the PRP and stem cell after, which is exactly what we did with her. So to get 12 months of relief, and where she's been in I don't like using the chronic pain, but long-term pain for many years before she saw us in 2019. So that's huge. So one more thing, shout out to my buddy from up north. I was able to spend some time up north, which was great. It was the first time up north this year. I'm glad I was able to do it. But what brought up the subject is that everybody's got toys and bikes, and everybody's trying to get out and stay active, especially with COVID, especially with the gyms closed and things like that. The biggest thing, I know I've said it before, but I'm really going to emphasize it now, you have to use proper equipment. To pull that old Schwinn bike out where it hasn't been used in 20 years, dust it off and throw it out there. It's great to do it. I absolutely encourage you to do it, but I need you to have proper equipment. Proper equipment with anything is important. So if you don't have proper equipment and you want to go long distances, that's going to lead to the back injuries, the neck injuries, the wrists, the ankles, especially with biking or kayaking. If you're kayaking in something that's not as efficient, you need the right equipment. I commend you, absolutely, you need to be exercising. Just make sure your equipment is appropriate. If you're starting to feel discomfort, don't cause spasms or hip issues or shoulder issues because you're just kind of pushing through it. We can make some adjustments to your routine that you're doing. But overall, I think, again, a great week. We really encourage you to push this out to your friends. My new staff is awesome. We're looking so forward to getting back to some type of the new normal, which we feel we're at. We got great new physicians and front staff and physician assistants. Again, we specialize, we're seeing everybody from telemedicine, in the office, injections, and pretty much we in all ways are open to everything we used to do. And now with Dr. Abrahamson with her peptide treatment, myself with the stem cell and PRP, Dr. Bonette doing headaches, I feel we cover a pretty large spectrum to care for just about everybody from a non-surgical standpoint. And again, we push for non-surgical, but we don't keep you from a surgeon if you need it. And again, we're taking the new patients. Again, crazy times. It's hard to have conversations out in public these days. Political, Black Lives Matter, the whole thing. We're not going to try to get into it here. I mean, we really, again, I talked to someone for a while, and I hope everyone just judges yourself on who you are as a person and how deep your soul is. And that's the main message. So peace out.